Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. If you're watching this video, it means we've now covered about 50 FDA-approved medications in allergy and immunology on this channel. You know what? Looking back at the very first video I made, it is amazing how quickly time has passed. I want to really thank everyone who has subscribed, followed along, and supported this channel. I truly appreciate it. Your support means a lot to me. Today's episode focuses on an important over-the-counter oral antihistamine that is particularly relevant during allergy season. If you or someone you care about has questions about dosing, available formulations, or whether this medication might be right for you, this video will be helpful, especially if you have not tried it before. In this video, I'll walk you through 5 key things you need to know about Xyzal. Its indication, how it works, how to use it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Xyzal and who it's for? Xyzal is an oral antihistamine that contains levocetirizine. The over-the-counter formulation is approved to temporarily relieve symptoms caused by hay fever or other upper respiratory allergies, including runny nose, sneezing, itchy or watery eyes, and itching of the nose or throat in adults and children 2 years of age and older. Xyzal has a long-standing regulatory history. Its prescription formulation was first approved by the FDA in May 2007, with an expanded indication in August 2009 to include children as young as 6 months. In January 2017, it transitioned to over-the-counter status, providing access to the same active ingredient and strength without a prescription. It is important to note that while the prescription version is approved for children down to 6 months of age, the over-the-counter version is only labeled for ages 2 and older. For children under 2 years of age, a doctor should be consulted before use. Second, how does Xyzal work? The active ingredient in Xyzal, levocetirizine, is an antihistamine. It works by blocking histamine, the chemical involved in allergic reactions that leads to symptoms such as itching, inflammation, and increased mucus production. It's also important to set expectations. The onset and degree of symptom relief can vary from person to person. Based on clinical studies, Xyzal typically starts working within about 45 to 60 minutes after the first dose, and its effects can last over 24 hours, supporting one's daily use. Third, let's talk about how to take Xyzal. Xyzal is available in both tablet and liquid forms. The tablet comes as 5 milligrams, and the liquid is 2.5 milligrams per 5 milliliters. For adults and children 12 to 64 years of age, the recommended dose is 2.5 to 5 milligrams once daily in the evening, depending on symptom severity, with a maximum of 5 milligrams in 24 hours. For children 6 to 11 years of age, the recommended dose is 2.5 milligrams once daily in the evening. For children 2 to 5 years of age, the recommended dose is 1.25 milligrams once daily in the evening. For younger children, the liquid formulation is more suitable, as it allows for more accurate dosing and may be easier for those who have difficulty swallowing tablets. Extra caution is needed in certain situations. Because Xyzal is primarily cleared by the kidneys, patients with kidney disease should not take it unless they have first consulted a doctor. Older adults, especially those 65 years of age and older, are more likely to have reduced kidney function. Patients in this age group should ask a doctor before use. Dose selection should be made carefully, and monitoring kidney function may be appropriate. If a patient is pregnant, a healthcare professional should be consulted before use. If breastfeeding, Xyzal is generally not recommended. Fourth, let's review the warnings and precautions. Hypersensitivity reactions, including anaphylaxis, have been reported with Xyzal. Patients with a known allergy to levocetirizine, any of the ingredients in Xyzal, or cetirizine, a closely related antihistamine found in Zyrtec, should avoid use. Compared to older antihistamines like Benadryl, Xyzal is less likely to cause drowsiness. However, some individuals can still feel sleepy. Do not drive, operate machinery, or perform tasks that require alertness until you know how Xyzal affects you. And avoid alcohol or other sedating medications that may increase drowsiness. Urinary retention has been reported in post-marketing experience. Use caution in patients with conditions that may increase this risk, such as prostate enlargement or nerve problems that impact bladder function. A healthcare professional should be consulted before use in individuals with a history of difficulty urinating or emptying the bladder. Stop use and consult a doctor if trouble urinating or emptying the bladder develops. Lastly, in May 2025, the FDA issued a warning that patients stopping the oral allergy medicines, cetirizine or levocetirizine, after long-term use may experience severe itching. Although rare, this is something to be aware of. For more details, please refer to my previous episode, link above. And finally, let's talk about the side effects and safety. In clinical trials of adults and adolescents ages 12 and older, using 2.5 to 5 milligrams once daily, the most commonly reported side effects included drowsiness, fatigue, dry mouth, cold-like symptoms, and sore throat. Longer-term studies extending up to 4 to 6 months showed a similar safety profile. Drug discontinuation due to side effects was low, around 2% with Xyzal compared with less than 1% with placebo. In children ages 6 to 12, using 5 milligrams once daily, the most commonly reported side effects included drowsiness, fever, cough, and nosebleeds. In children ages 1 to 5, using 1.25 milligrams twice daily, the most commonly reported side effects were fever, diarrhea, vomiting, and middle ear infections. Overall, most side effects are mild to moderate and uncommon, occurring in less than 5% of patients, with many reported at rates similar to placebo. After approval, additional adverse events have been reported through post-marketing data. Although it is hard to determine how often these occur or whether they're directly caused by the medication, these reports highlight the importance of stopping Xyzal and consulting a healthcare provider if new, persistent, or worsening symptoms develop. And there you have it, 5 key things you need to know about Xyzal, a once daily oral antihistamine that is widely available over the counter and helps control allergy symptoms. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.